In 2014, what slide 54 indicates the fact that the tax credit jumps up to 50% if you, as an employer, provide at least 50% of the premium. There's also changes in Medicare Part D, that's the drug program. There's discounts for brand name drugs, means testing for Part D premiums, phases in competitive bidding on Medicare Advantage programs, and the second to last bullet says Medicare Part D tax changes beginning in 2013. When this was first introduced in 2006, there was a drug subsidy of 28%. Starting in 2013, that goes away. Many large businesses had a 28% subsidy, and that's why these large companies are complaining. In addition, starting in 2010, the donut hole for Medicare Part D goes away in 10 years. When this was introduced in 2006, they provided coverage after $250 deductible, and then there was a period where there was no coverage at all, and then catastrophic. Eventually, over a 10-year period, that donut hole is going to go away. There's also going to be a myriad of new taxes. Starting in 2013, Medicare payroll tax is going to be increasing by 0.9% for those individuals whose incomes exceed $200,000 for individual, $250,000 for couple. There's going to be excise tax, my favorite, on indoor tanning salons, and fees for health insurers, pharmaceutical manufacturers, and medical device manufacturers. One of the more interesting taxes is slide 57. There's going to be a 3.8% capital gains tax for those individuals earning $200,000 for single, $250,000 for couples. If your income is below that, there's no additional tax. As soon as your income goes above that, all your capital gains will be taxed an additional 3.8%. Now remember, the Bush tax cuts go away in 2011, so capital gains will go from 15 to 20, now to 23.8 in 2013. There's also going to be changes to HSAs, health FSAs, and HRAs. Starting in 2011, this is January 2011. No longer can these plans reimburse over-the-counter drugs. The government doesn't care what your plan year is. As of January 1st, 2011, no longer can these plans reimburse over-the-counter drugs. Also, in 2011, the penalty tax for HSAs goes from 10 to 20%. That's if you spend your HSA for something other than medical expenses. And in January 2013, health FSA contributions are going to be limited on a calendar year basis to $2,500. Now they're going to put in a simple cafeteria plans. These for companies less than 100. They will provide forms. And as long as you meet the rules, there's going to be no non-discrimination testing. And this will go into play starting in 2011. Now, one of the more important changes is covered on slide 59. And the government just released guidance on this yesterday. And what they're saying is, if you provide medical coverage or reimbursement for dependents, that reimbursement or that premium is tax-free until the taxable year in which that person turns age 27. So the first bullet says, tax-free treatment for adult children who have not turned age 27 as of the end of the calendar year. Now what's important is that this change is effective for any premiums or reimbursements made after March 30th, 2010. So it applies to group health plans, cafeteria plans. This is extremely important, and what this means is And this is different than the other provision about age 26. This is effective now. So if you provide dependent coverage or health FSA, as long as that child hasn't reached 27 by the end of the year, that reimbursement of that coverage is tax-free. Doesn't care if it's married or single, doesn't care how much support. The only requirement is that they haven't reached age 27. This is extremely important. And this provision is effective now. And this was discussed in a notice that was released yesterday, Notice 2010-38. Also, there's other wellness incentives. This is starting in 2011. If you're a company with less than 100 employees and you establish a new wellness program, what this slide is trying to say is HHS will give you money to establish a wellness program. And this is effective in 2011. This program will go on for 5 years. So information on this will be coming out soon, but the government will give you money to establish a new wellness program. And lastly, the individual mandate will be in place starting in 2014. Not only employers will have a mandate, but individuals will have a mandate. And if an individual doesn't get coverage, the penalty is calculated the lesser of these amounts: the national average premium for the year, or the greater of a percentage of income up to 2.5% in 2016, or a dollar amount of $695 in 2016. So let's say you have an individual that's age 25. Their employer doesn't have health coverage. And they go on the exchange and they see that premiums are $300 a month. And they look at the penalty, it's $695. What are they going to do? Are they going to get coverage? Because remember, starting in 2014, when this is applicable, insurance companies cannot charge or cannot impose pre-existing conditions. Most people are going to pay the penalty and wait till they get sick. They can jump on coverage. So you'll get phone calls on the way to the hospital to get coverage. People are not going to spend the money to get coverage if they don't need it.
Thank you, Attorney Grudzien, for that incredible amount of information. I know everyone listening is pretty much as blown away as I am. National Healthcare Advisory, as you can see on your screen, there is a lot that we can do for you. And our contact information. If you need to also contact Attorney Grudzien, you can give us a call at 877-SOUND-MIND or 877-768-6364, or send us an email, myself, Joel, at National Healthcare Advisory, or Joe and Operations. Again, thank you so much.